Hi, my name is Tamia. I'm a student physical therapist assistant, and today we're going to be going over NMES. So, NMES is used a lot for muscle strengthening, muscle re-education. It's used a lot in the setting where a patient is recovering from surgery and we're trying to get those muscles to fire up again and strengthen when we don't have clearance to do like weight-bearing exercises and activities. So we're going to be going over the parameters on the NMES machine first. So here I have my 2 channels plugged up, and then I only need 1 channel though. So I'm just going to use this 1 channel for my NMES, and today I'm going to be doing my quad. So there's different settings we can set it up for. We can set it up for muscle strengthening, muscle re-education, and then to decrease muscle guarding. On myself today, I'm going to do the muscle re-education setting. So this opens up here, and I can change my parameters. But to first turn it on, I'm going to go ahead and move this intensity knob to turn on the channel that I'm going to be using. So I'm going to go ahead and turn the machine on. And then here I can go ahead and go over my parameters. Let me move it closer. Okay, so I'm gonna go ahead and change my parameters to the muscle re-education setting. So for the pulse frequency, it's gonna be from 20 to 50. So I have my frequency here. So from 20 to 50, I'm gonna leave it here at 30. So that's within the parameters for muscle re-education. Pulse duration is 300 to 600. I don't have a setting to change for that one, but this one goes up to about 250. As far as the amplitude and intensity, which I would change here, that's going to be kind of relative to the patient. We want to make sure they get a strong muscle contraction. So we would go up until we receive that strong muscle contraction. As far as the on and off times, for muscle re-education, we would do either 1-to-1 ratio or 1-to-5 ratio. So for this one, I'm going to do a 1-to-1 ratio, and I'll do 10 seconds on, 10 seconds off. So I can change that here. This is time on, and then this is relaxation time. So I'm going to change it. That's at about 10, and this is at about 10. And then here we also have the ramp time. So that's the amount of time that it takes for the contraction, for the patient to feel the contraction. So that can be from 1 to 3 seconds. So I have it here at 3 seconds. So it looks like my parameters are good. If I were to do muscle strengthening, I would just change a few parameters. Pulse duration would be the same. Pulse frequency, I would do 50 to 80. Again, I would do the intensity until we feel a strong contraction, and then we would do 10 seconds on, 30 seconds off. But I'm gonna go ahead and do muscle re-education. So we'll go here so you can see. Okay, I'm gonna go ahead and wipe off my leg with a alcohol pad. If your patient has lotion on, you want to make sure you wipe down the area to get any lotion off. Okay, I'm going to go ahead and apply the pads. Okay, so I'm going to put one pad here. And then the other pad will go up here. So I'm kind of going like the length of my quad muscle to get the contraction. So and again, I'm just using 1 channel. Okay, so I have my parameters set. So now I'm going to go ahead and increase the intensity. And when we do NMES with a patient, we like to pair it with functional activity and exercise. So since I'm doing my quad, I could have the patient do like a leg extension or a long arc quad or something like that, or a quad set. Okay, so yes, I'm going to go ahead and increase. And when you are teaching your patient to do the exercise with the NMES, you want them to during the on time when the muscle's contracting, that's when you want them to perform the exercise. so they're working with the machine. So right now I'm feeling like a tingling sensation, but we want to get the muscle contracting. Okay, so I got a muscle contraction there.
Tomorrow?
Okay, let's see if we can get one more.
Jesus. Can you teach me class? I'll bring you out.
So I'm getting the muscle contraction, so I'm going with the machine. And when we do NMES, we can do, depending on what setting you have it on, we can do between 10 and 20 minutes, or it kind of varies depending on your goals for the treatment. So we'll do one more contraction. Could probably go up a little bit. Okay, and to turn it off, you just turn the intensity down all the way and then it clicks off. You'll know it's off because the green light will turn off. And then we'll go ahead and just take that off. You always want to make sure you turn the machine off before you touch the pads. And then to take the pads off, you don't want to pull from here, you want to pull from there. Okay, and that's it for NMES.